What does a dermatologist think about using Botox to treat rosacea? Stay tuned to find out.
Rosacea is a long-term skin condition that typically affects the face. It results in redness, pimples, swelling, and dilation of blood vessels. Often the nose, cheeks, forehead, and chin are most involved. Unfortunately, rosacea is not curable, but treatments usually improve symptoms.
This is all correct. Rosacea is a chronic inflammatory skin disorder. There are a few different types. There's the papulopustular form, which is characterized by red papules or bumps and little pustules. That typically responds well to topical medicines like metronidazole, ivermectin, azelaic acid. Then there's the erythrotelangiectatic type of rosacea, which is characterized by dilated blood vessels in the cheeks, forehead, nose, and this is typically treated with vascular lasers.
In this case, we are using Botox to treat this patient's symptoms. Injections of dilute Botox can relax hyperactive blood vessels and reduce skin redness, flushing that's associated with rosacea.
Using Botox to treat rosacea is a new concept. The theory here is that Botox is a neuromodulating agent, meaning it relaxes muscle. There are small muscles on the components of vasculature, and the idea is that if you can relax those small muscle components of the blood vessels, that you might improve some of the redness. What does the literature have to say about Botox and rosacea? This is a review looking at 9 studies totaling 130 patients, which suggested that Botox may actually be helpful for rosacea, but they couldn't make definitive claims given the number of patients that were treated. This is a selected before and after for one of the studies previously mentioned. Pretty significant improvement, but obviously you can't generalize this to all patients. In comparison, here are a few before and after pictures of patients treated with pulse dye laser. This is what I would consider gold standard therapy for treating rosacea patients concerned about redness. The laser directly targets hemoglobin inside the blood vessels. It heats them up, they're obliterated, and they disappear for years. This is a highly effective, long-lasting treatment backed by lots of clinical studies. So what's better for treating the vascular component of rosacea, Botox or an IPL? There was one split-face study where participants received IPL on one half of their face, whereas on the other they received IPL followed by Botox. The combination group that received both IPL and Botox had more significant improvements in redness than the IPL alone group. So certainly lots of promise for this combination therapy, but more studies still need to be done. Right now, if you only had to choose one, I would pick a vascular laser as there's more evidence and the results are going to last longer than Botox. It's going to be a more affordable option with more consistent results.